All right, welcome back to ABA exam review and the continuation of our RBT practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass the exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Landon just learned his home address and phone number. Landon can tell this information to his technician and parents. His team mastered out this target and moved on to another goal. Yesterday, Landon's sister asked his address and Landon could not answer. What did the team forget to do? Now, we're evaluating a situation where we've mastered a target, but the team forgot to do something prior to the mastering of that target. In this case, Landon was learning addresses and phone numbers so he can tell it to other people who might need that information to help Landon. His team mastered the target and moved on to another goal. Unfortunately, when Landon's sister asked Landon his address, he couldn't answer. So Landon can tell his address to technician and parents, but not his sister. Meaning, Landon might struggle telling his address to people he hasn't talked to before, or who he doesn't know, or who's never asked him that question before. And why would that be an issue? Well, in this case, it's going to be a big deal if Landon can't tell his address or phone number to, let's say, a person at a store that Landon is lost in. So, what did the team forget to do? A, check for generalization. Yes, before we master targets out, before we move on from teaching, we need to check for generalization. It's arguable that if we aren't generalizing skills, we're not actually accomplishing anything. We can only do so much and accomplish so much by teaching something in a controlled environment and then leaving it there. We have to make sure that skill is traveling outside of the teaching environment and the people who are teaching that specific skill. What about B, fade the prompts? Well, nowhere in the question do we discuss prompts, do we talk about prompts? So B does not seem relevant because we're not talking about prompts or what prompts were or were not used. C, you should not master safety skills. That's not necessarily true either. We're not going to work on this forever. If Landon, 10 years from now, he should know his address and phone number, hopefully without ongoing teaching. So you can absolutely master out safety skills. And then D, teach Landon every possible scenario before mastering the skill. Again, that's unrealistic. You can't teach every possible scenario. There could be hundreds of situations where Landon may need to know his address or phone number. We just can't prepare for everything. That's why generalization is so important, because for those times we can't teach explicitly when that skill needs to occur, it's important that the skill does generalize. So the team, before mastery, forgot to check for generalization. Tyler is a drummer and working on a new song. He is consistently playing the song too fast during certain measures. So when he gets to the measure, he tells himself slow, 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 and plays the measure slower. What type of prompt is Tyler using? All right, so let's think about Tyler here. We're looking at the prompt that Tyler is using. So we have to first identify the prompt and the scenario. We know Tyler's a drummer. He's working on a song, and he's playing it too fast. So he wants to slow down. When he sees the measure, which is our SD, he then prompts himself, slow, 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 and then responds by playing the measure slower. So that prompt here is telling himself slow, slow, slow. So if Tyler is prompting himself by talking to himself, what type of prompt would that be? A, modeling. With modeling, we are doing the actual response and demonstrating the response. Tyler isn't doing that to himself. He's verbalizing to himself, slow down. B, gestural. A gestural is a motor movement indicating what you want to happen. Tyler is verbally speaking the prompt. C, movement. Movement is like a positional prompt where we're moving stimuli around. Tyler isn't doing that. Tyler is giving himself a verbal prompt. By getting to the measure and then saying slow, slow, slow prior to the response, he's verbally prompting himself to slow down and play that measure slower. You've been collecting duration data for 2 weeks now on a new target behavior. You suddenly notice that all your data from the last 2 weeks is incorrect and start to panic. What should you do next? Okay, so this is sort of a ongoing session management type question. It's kind of ethical as well, because you might come into situations where something's gone wrong, you've done something wrong, and the last thing you want to do is panic because we need to work it out. And the person you're going to rely on is your supervisor. In this case, you've been taking data for 2 weeks, and then you realize it's all incorrect. Well, on one hand, 2 weeks is gone, and the data is bad, and we can't use the data. On the other hand, you've caught it, which is great. You caught it early, you caught it soon enough. Now we can change it. So instead of panicking as the technician, what do you do next? A, change how you're taking your data so that it is no longer incorrect. Yes, but there's a bigger issue at hand. You've already taken data incorrect for 2 weeks now. So just suddenly changing how you're taking data, are you sure that's the correct way to take data? What about the last 2 weeks? That can't be your first instinct. You got to do something before that. B, let your supervisor know immediately and request training. Yes, you've noticed you've made an error that's been going on for 2 weeks. You need to let them know immediately, and then you've got to get some training to correct that error. Don't just try to correct it yourself. Go to your supervisor, be honest. Good supervisors are going to thank you for being honest, and then they're going to train you. That's how you know you have a good supervisor. So don't be afraid of your supervisor. Let them know. What about C? Because we read all of our answer choices. Delete the data from the last 2 weeks. That's not your call. You need to ask your supervisor what to do next. They'll decide what to do with the data. And then D, report yourself to the behavior certification board. You haven't done anything ethically wrong. You haven't done anything wrong. You made a mistake. Everybody makes a mistake. It could have happened for a number of different reasons. What you need to do is not panic, but you just have to let your supervisor know immediately and request training so you can get back on the right foot and start collecting data the right way. Clark eats cereal every morning for his breakfast. Clark will eat a cereal, then say, "I'm all done, Mom," and his mom will take his empty bowl away and put it in the sink. Clark always communicates this way. What is impacting Clark's behavior? We're looking at Clark's behavior, and importantly, we know Clark always communicates this way. Something must be maintaining or increasing his behavior. And if behavior continues to happen, we know it's being reinforced. So immediately, especially if you've been working for a while or you've been practicing your fluency and doing practice questions, you may have picked up immediately reinforcement is occurring because he's continuing to do this behavior. Now, what type of reinforcement? We know Clark eats a cereal, says all done, and then what happens? The bowl is removed. The bowl is taken away. And when something is taken away as a consequence, is that positive or negative? Going to be negative. If we look at A, positive reinforcement, it is reinforcement because Clark always communicates his way, that behavior is maintained, but it's not positive because the bowl is being taken away as a result of him saying, "I'm all done." So what we're looking at here is B, negative reinforcement. Why is it not C or D? Well, it's not punishment. If this was punishment, Clark's behavior of saying, "I'm all done, Mom," would decrease because that's what punishment does. It decreases future behavior. Not the case. Clark's future behavior continues, maintains, increases. He's being reinforced. How is he being reinforced? By the removal of a stimulus. Therefore, Clark's behavior is impacted by B, negative reinforcement. Rachel, a behavior technician, has been assigned a new client named James. During her initial sessions, Rachel notices that James' parents often ask for personal advice on how to handle various family issues that are not related to James' therapy. If Rachel wants to remain ethical, what should she do? This is a difficult situation for technicians. When you're working directly with parents, you want to establish a relationship, a professional relationship, and you want them to trust you and you want them to be open with you. But sometimes it might cross the line. In this case, if James's parents are asking for personal advice on family issues, that is not within Rachel's scope. She's just the behavior technician. We don't mean that in a negative way. A behavior analyst should also not be discussing and giving advice on family issues. So if you're this technician, if you're Rachel and you want to be ethical and a family starts asking you about personal things and family issues, what should you do? The key is it's not related to the therapy. A, provide James' parents as much help as possible in order to avoid harm. Well, regardless of your background, you're not there to give them advice on family issues and personal related things. That's not your job. So you might think you're helping, but there's also a very good chance you could hurt in the long run. It's not your role. It's not your scope. A is not good. B, give James' parents a list of websites that she knows about and that she has used in the past. Should Rachel give her own curated list of websites? No. If it's a company approved website or a supervisor approved website or list of websites, that would be okay for Rachel to give, but not her own list. It's out of her scope. C, explain that she can only provide information about James' current treatment. Yes, that's what she needs to do. I can only talk about James's current treatment. You can talk to my supervisor if you have other questions. And then D, put James' parents in touch with a qualified counselor or therapist that specializes in their issues. The analyst might do this, the supervisor might do this, but again, it's not in the technician's scope, it's not their role. Their role is to implement plans and talk about the specific client's treatment, and that's it. So if Rachel wants to remain ethical, she should explain that she can only provide information about James's current treatment. Thank you so much for watching. Be sure to subscribe for all of our updates. Check out btexamreview.com for our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.